Good afternoon, everyone. So we are towards our last session, and now Dr. Mahati, it's our turn to ask questions. Uh, Dr. Mahati is an associate professor of health and medical psychology at IIT Hyderabad, and she uses mixed methods research to understand psychosocial and cultural aspects of diabetes care. And she's a consultant advisor for several medical care organizations and is the founder member of Health Associated Cooperative and Supportive Group. So she's telling us today how to manage our burnout. So all the busy doctors are here in the room to listen to you.
Can I not stand on that? Can I just use this and maybe use something to kind of move my slides? Can I also then get my PPT loaded up on this? It's just the next button, is it? Okay. Yeah, so, I think it's a bit of a joke, right, that I have an image of myself with a mic. So yes, I ask a lot of questions, and I think I've established that very comfortably here in this conference. So first of all, thank you, especially to Tejal, though she's not in the room right now, because I think her faith in wanting to talk about these kind of what people would call softer aspects of being a professional has at least brought this into a fairly mainstream dialogue, even though it's 1 o'clock. Managing burnout, I mean, honestly, my first question when I hear people talk about burnout, especially intelligent people like yourselves in this room, is it really that? I mean, do you really just only want to manage your burnout? So that's what we're going to be also talking about. And there's a little bit of skill at the end of the talk. Which I'll also introduce you to. Just to kind of give you a quick background, the Health Associated Cooperative and Supportive Group is a research group that I've started, but it's growing beyond just the people involved in our research group via IIT Hyderabad, and you can see all the list of research areas that we're interested in. So cancer is my primary area of work, but endocrinology kind of, especially psychosocial diabetes, kind of just grew with. I think in India you can't not be, doing research in endo if you're going to be a medical psychologist. And there are a whole lot of other areas of work, but I'm also now doing a lot of work in safe sex, along with working with med tech companies on improving, patient outcomes and all of that stuff. So this is just, I'm going to now introduce a little bit of research before I go on to talking about the skills. Something that emerged during the pandemic and afterwards is that Asian healthcare professionals specifically would report a lot of issues around mental health, so depression, anxiety, insomnia, and so on. So it is something to really reflect upon, what's happened to you during and now after the pandemic. And there is really a concept of new normal, especially for doctors. I also wanted to kind of throw some theory at you because that's what psychologists do. If you guys have thrown, all these MABs and all these other words at me, I'm going to throw words at you too today. The theory is our word. So role theory is something that I would have wanted you to reflect upon when you go back. Role theory is basically, it has two concepts to it. One is called role overload. That's when, you are having to do more than you are supposed to be doing. So there's this overload feeling that you would encounter. So something like Dr. Chitra yesterday was talking about, right? So I have to do this, I have to do that, I have to think about this, and I have to think about that. There's just so much, right? So the role overload is very high, especially for doctors compared to other, highly skilled professionals. Then there is role conflict that doctors go through, especially female doctors. Okay, and because this is a women's endocrinology conference, I am going to keep talking about women and keep pushing that feminist agenda, so you're going to have to deal with that. So the role conflict is where you're being forced to balance both your professional and personal life all the time. And say, for example, like those examples over there, right? You have a Diwali celebration, but you have to do IPOP. That's just like hard, like classic, right? But if you think about more nuanced things, there's even more that goes into it. So you're probably seeing a sick patient, but your kid is not well at home, and you have to kind of balance both of those things as well, right? So many times, there's conflict, also role conflict, inter-role conflict between you and probably your physician husband, and so on as well. So it's something to really think about in terms of, if you want to look at what you're going through, then think of it maybe in the caveat of role. I'm definitely going to overshoot, so there's no point in even having that thing. I'm going to be 3 to 4 minutes over. Sorry, Chitra. So this is again an idea to give you an idea about which phase you are probably in and what you probably are going through in terms of your burnout. Now, for early physicians, I think it's starting to amp up, but it's actually middle career physicians. Almost all of you are middle career physicians over here, and you're probably going through the worst phase of your life right now as physicians. All right, so there's a lot of dissatisfaction, there's a lot of juggling, and there are a lot of apples up in the air right now for you, okay? Now, this is an interesting slide, and I put it up, even though it's slightly dated in terms of the research, because I think it's really evocative and important for you to think about. So what is it that you are taking positively out of your work, right? So when I ask doctors, because this is an image, I couldn't even do any fancy animation, so you're going to see all the answers on the screen itself. But usually I like to ask doctors, why are you a doctor? Like, why did you choose this, right? And they'll say, oh, it's service. No, I really wanted to do the best I can do for my country, and, I really like to see healing people, right? And some oncologists especially will talk about feeling very compassionate and empathic towards their patients. Now, the flip side to that is that you'll also experience those things. So what your reason is also the other side of the reason is something negative. It's exactly with husbands, right? Like, you marry them for certain reasons, but the flip side is also this. So I married my husband because he's this giant, but, in terms of work and physically also. But it's also kind of crappy because, it means then we're constantly managing time, right? I'm like, even I want to be alpha. You want to be alpha, I want to be alpha. Now, who the hell is going to be beta and take care of the kids, right? So, what is your reason to be this person? There's also a flip side, and you really need to assess that. So if you think that you love being a physician because, service is something that really pushes you, then you have to be ready to feel some level of deprivation as well. All right? And similarly, then you have to also accept that these are going to be the burnout indicators that you're going to encounter. So compassion fatigue and feeling entitled. I see that in a lot of senior physicians who, those who are born in the 60s and 50s especially, they get into it because they want to do something. But that also means then they have to be right. Right? So that can make you feel very tired if you have to be right all the time. And then there's a way in which you can address this. So if you want to be right all the time, you also need to kind of become more grateful for the things that have gone right. So because if you want to be right all the time, you're probably focusing on all the things that can go wrong all the time as well, right? So these are kind of techniques, and I spend a lot of time on this slide actually, and we talk about skills, but for today I'm just gonna, stop over there. And this is my own quotation that I came up with, okay? So I write poetry, which is my way of kind of getting the anxieties and everything out. But, whenever I ask people, how do you, that's why I said, is burnout really what you want to do? And deal with burnout, is that it? Because that's just coping. That means you're just treading water. You're just kind of somehow staying afloat. But what you really want to do is self-care. You want to swim, right? So I think that in a quest to manage your burnout, try and see if you can go a little deeper than that and ask yourself, how am I taking care of myself? Okay? So when research shows us that doctors say that they barely ever take care of themselves, okay? And they don't do too much of stress reduction stuff. So they don't even try to cope. So forget about self-care. Right? So yeah, I'm a bit of a stand-up comedian, as you can tell. So hopefully you'll not see the time overshoot. But if you, again, see what are they doing when we say, okay, chalo, let's call it self-care only now. So what are you doing for self-care? You'll see that a lot of them will say exercise. Now, exercise, again, is very structured. It's a very, it's a very output-oriented behavioral thing that you can measure. But if you think about the stuff that you cannot measure, like deep breathing, mindfulness, meditation, you'll see that, it kind of starts depleting those numbers, okay? And this is a Caucasian group as well, so it's different. But why? Why doctors, don't think about coping, and they just keep firefighting? It's because of the self-talk, I've noticed. So I really enjoy conferences like this. So I'm really grateful to Tejo for inviting me. And please, this is a call out to the rest of you guys. If you have conferences and I can attend it, I'd love to do it. Because I just enjoy listening to doctors. I enjoy listening to why they are who they are, why they decide the things that they do. Because I hear a lot of this kind of talk. I must follow protocols. Oh my God, yesterday and today was about guidelines, protocols. There are no protocols for this, so we shall discuss this, right? So there's a lot of, it's if you think about it from a psychological point of view, it's a lot of fear signaling that's going on underneath that, okay? So I have to be strong is another one that I hear a lot of female doctors talk about. I must do this. Right? So I would grow another arm, I'll sprout another foot, I will do whatever it takes, but I must do this. And then I should go home and wear my gungrus and do all the stuff that has to happen at home as well, right? So there's a lot that female doctors specifically go through. So the self-talk is even harsher for women than it is for men, because I've noticed many times, and I'm always amazed how men can wake up and think that they're awesome. I'm like, how are you doing this? I'm waking up thinking I'm crap, and I sleep thinking I'm crap, but how are you doing this, right? So female doctors especially wake up, with a lot of that, a lot of chatter. So as I was saying, doctors are probably not very good at self-care. They don't take care of themselves physically as well. I ask doctors, what do you do for your mental health? Nah, but they'll tell their patient, you should get your checkup done regularly. But what about your mental health checkup? Right? So a lot of doctors don't do that. A lot of doctors self-prescribe, as you probably already know. There's this discourse about being self-reliant, individually driven, and achievers. Oh, sorry, I didn't know that you were taking a picture. Yeah. Doctors, yeah, so, and you must be self-sacrificing and industrious, right? So these are the language, this is the language you're growing up with as a female especially. So, I would have invited you to really think about self-compassion instead. It's not about managing burnout, as I was saying. It's more about how are you really meeting yourself, and how are you able to embrace yourself. So there's a really big difference between self-compassion and self-esteem. Self-compassion is about being kind to yourself when things are really, really bad, but sometimes also when things are really, really good, okay? Almost as if you were your own friend, okay? So what would you say to your friend, if you're really tired, you have a fever, and you're still at work, right? Would you tell your friend, get up, come on, do that presentation? Or would you tell your friend, do you want some water? Do you want to take a Dolo 650? Do you just want some time? Do you want Mahati to shoot into your talk so that you have less time to talk on the stage? So, you just don't know, right? So self-compassion is something that you need to do that way. Self-esteem, on the other hand, is very outwardly driven. So it's about what other people what other people say, and how are you kind of taking in that signal. So this is just an example. So if you get a promotion from consultant to senior consultant or something else like that, to say that I deserve this, and I'm happy I got this, versus saying, now I can go tell my husband to shove it. Right? So I said, I'm sorry, I'm really, really inappropriate. I'm just really glad that there's so few men to bash me afterwards. Yeah, it's being recorded, huh? So how do we do it? How do we do self-care? There are a whole bunch of things. One is you start paying attention to yourself. You pay attention to how you're talking to yourself. That was what I was asking yesterday as well, right? And can you consider putting in more kinder phrases to yourself instead, okay? Putting in more daily intentions. So I wake up every day telling myself, may I be happy, and may I be kind, and may I be satisfied with myself. And whenever I hug someone, that's what I think in my mind. I say, may you feel loved. You know, so saying something simple like that every day is a great invitation to feel good. You should probably stop that sound. I'm nearly coming to the end anyway. Self-compassion breaks are also something that's great to consider doing, especially when things are unpleasant that is going on. So a simple self-compassion break can be taking some deep breaths, going into the washroom, and saying, I'm gonna now make myself feel pretty by putting some lipstick, you know? That's a self-compassion break as well. But to be able to say that to yourself, rather than saying, I better put lipstick so that I don't look tired or I don't look anxious. That's not the thing that you're doing, right? So little self-compassion breaks in the middle of the day for yourself are going to really take you a long way. You know, everything that you're already doing, you're taking lunch, right? So if you're gonna eat lunch, just tell yourself, I'm going to enjoy this lunch, or I'm taking lunch to nourish myself. Just being able to narrate the things you're already doing to take care of yourself is itself a self-compassion break. And then the other thing is to understand that what you're going through is common and shared, but I think that a lot of you already know that. I think it's also unfortunate that women, it's only in our 40s that we start kind of leaning into each other and not looking at each other as a threat, and we start enjoying our friendships more, you know? I noticed that you know, we kind of you know, take on a very masculine energy until that time, and it's 40s when we're like, screw this, you know, this is who I am now, you know? That's how I'm gonna be, right? So that's that, you know, I'm doing that with my weight. I was like, June, that's it. What weight and shape I am that's what it's gonna be, and that's it, right? So I think we get that, we get there when we're in our 40s. Last concept, and if there's only one thing I want you to take, apart from me being really funny, is that the concept of self-sufficiency. Okay, this is something I was telling Tejal that I'm going to change my slides around based on how the day yesterday and today goes. And the first word that came to me when I saw all of you in so many different lights, right? So it was not just the pharma boys watching you guys, I was watching you too. I noticed that there's this strong discourse on being self-sufficient. I can see so many of you working really hard to become that self-sufficient person. There's nothing wrong, obviously, with it, although you're probably thinking I'm saying it's wrong. It's amazing that you're wanting to be self-sufficient. It's important to be self-sufficient. But it's the narrative that you're probably attaching to it. Being self-sufficient is about knowing that you can take care of yourself. But asking someone to take care of yourself is equally important. So, you know, if you want to try an exercise at the end of today, on your flight back home or drives back home, think about what self-sufficiency looks like for you. And this is an exercise I do regularly, but I've been doing it for years now. So for me, for example, self-sufficiency right now, like this morning, I thought to myself, self-sufficiency will be if I can, you know, do this talk really well, and if 2 people turn up for this talk, that's itself amazing, right? But I'm going to anyway deliver this talk in the way that I want to. But it also, and I was really like tired because last night I pounded 3 glasses of wine and I ate like after like a huge break. So I was really tired and I couldn't really do my practices in the morning and I wasn't really up to it, to be honest. And I kind of semi-fell asleep during Sahana's talk, really sorry for 30 seconds, but I did. And I thought to myself, right, and we have to always ask ourselves this, have I slipped and slid into becoming a superwoman again, right? Because we all are superwomen in this room. If you have, especially if you have kids, oh my God, you're a superwoman for sure. And if you have a pet, then double superwoman to that, right? Because a pet never grows up and leaves your house. A kid does, you know, so. So you want to probably think about the things that are making you feel like you're, okay, these are the things that make me self-sufficient. Yeah. Then ask yourself, is this superwoman language? Am I becoming Wonder Woman? Don't check your panties, though. You don't have to do that. But the other thing, though, is have you become suprawoman now? Right? So because supra, as you imagine, is over and beyond super, right? And are you trying to get there now? And is that what the pinnacle of your pyramid looks like? So it's really important to ask yourself, am I being self-sufficient? And can I ask someone for my needs and express my needs? So becoming vulnerable, this is my last slide, guys. Becoming vulnerable is really important. And there's no better time than now for you to become vulnerable. And what I mean by that is to really understand what your needs are. Okay? Is your need to be hugged? Is it that you want to hear the words, I love you? Is it that you want your patient to tell you that I'm so happy that you are helping me through this journey? Or is it that, you know, your patient is not responding properly and those HbA1cs are just not getting fixed? And is it that your need is that you feel really bad about this and you want someone to tell you that you're doing the best you can for this patient, right? So what are the needs that you have? And asking yourself those needs is important. And I'll tell you one thing, it'll always come back to safety and security. As human beings, doctor or no doctor, professor or no professor, our needs are very basic. They're safety and security needs, just like roti kapra makan, right? You need to be in relationships that are safe for you. You have to be in relationships that are secure for you. So ask yourself that, am I feeling safe? Am I feeling secure with my teammates, with my colleagues, with my husband, with my kid, and all of those questions? Often I hear female doctors not feel safe with their husbands, just something that you should really think about. Being able to ask someone to meet your needs, and that doesn't always have to be your partner or your colleague at work, but asking someone to meet your need is important. And how do you do this? There are 3 steps to it, right? Becoming emotionally available to yourself. So simple tip, start using emotion words every day. Right? So it's kind of weird. My husband was like flipping out at me when I started this like 5-6 years ago. And like, Prakash, you know, I feel depressed when you do these things. I feel despondent when you do these things. I feel I'm being made lonely because you do these things, right? Or good stuff as well, right? So I feel elated when you do this. So just a range, just go see the Oxford Dictionary and swallow the adjectives there and use them, right? The more emotion words you use, the better you will be able to locate your own needs and your own emotions. The other thing is to challenge your negative self-talk. Every time you're thinking that, ask yourself why. And ask yourself, can I do an intentional journal around it? Okay, intentional journaling, you can Google it. There's a lot out there. And finally, deeply believing in your own worth. Okay? If you deeply believe in your worth, you will not feel a desire to be self-sufficient. You will understand concepts of self-regulation and co-regulation quite well. And how do you do that? You affirm your own worth to yourself. Say, you know, I'm worthy of this. I am worthy of wearing my clothes the way I'm doing it and things like that, yeah? So, oh my God, I'm so sorry. This is literally the last slide then. For sure, this is the last slide. I didn't know I put this. So a simple basic skill, yeah, is randomly in the day, right? Please don't do this as, oh, I'm going to do this every morning. I mean, it doesn't work. I've tried this too many times. And what works best, and especially for women, because we do the morning runs at home and stuff, is, you know, whenever you are going through something, and if you're not going through anything, great. And even then, do it, just randomly. You know, just ask yourself, what am I going through right now? Just ask yourself that and pause. The best time to do that is when you're using the loo, because at least once in the day you need to go and pee, right? Just don't take your phone with you. Go there and pee and ask yourself, what am I feeling? Where am I feeling it? Because our body will tell us, you know, all emotions are felt in the body and then signal to the brain. And then try out the Take 5 act of compassion, right? So this is simple. It's where you use your hand and you breathe in and you breathe out. Breathe in, breathe out. Breathe in, out, in, out. And it's supposed to really help because you're giving yourself sensory feedback while you're also regulating your breath. So something very simple. It's called Take 5, and that's it. Right, so I think I'm done talking. And thank you very much once again for this opportunity. And thank you for being patient, because I think I overshot by 7 minutes and not just this.